Hi, in this video, I'll be talking about how we treat low estrogen receptor positive breast cancer. So first I'll explain what that is, and then I'll talk about the approach we take in treating breast cancers that have low expression of the estrogen receptor. So, as you know, breast cancer we treat according to stage and also the biology of the tumor or its personality. And the estrogen receptor is one thing we look at on breast cancer tumors. Now, your pathology report is very likely to tell you the percentage of estrogen receptor. And what we call estrogen receptor low is people who have not zero estrogen receptor, but 1 to 9%. So over that, 10% or more, is not considered low estrogen receptor breast cancer, but 1 to 9% is. Now, these breast cancers are not the same as as ER negative breast cancers. We do use endocrine therapy, but we do tend to see with these tumors that their biology looks a little bit more active. I try not to use the word aggressive when I talk about cancers because that has a different meaning for people than what we intend. So estrogen receptor low expression, 1 to 9%, is a little bit different from more strongly positive estrogen receptors. In advanced disease or metastatic disease, we tend to see that these tumors are not quite as responsive to endocrine therapy. It doesn't mean we don't try, however, because hormonal therapy, endocrine therapy, is in general easier to tolerate than chemotherapy. So we'll always give it a good college try with endocrine therapy in tumors, even if they have low levels of estrogen receptors. We do see in people where we do things like genomic assays, the 21 gene assay, for example, is one of these, that tumors that have low expression for the estrogen receptor tend to have higher recurrence scores. So if I send a tumor for a tumor assay and the tumor itself had low expression of estrogen receptors, I tend to expect a higher score, meaning a higher risk of recurrence, but also a greater benefit of chemotherapy. So it's a little complicated. It's kind of betwixt and between more strongly estrogen receptor positive tumors and estrogen receptor negative. So we can send tumors that are low ER positive for the genomic assays, which is an advantage, to confirm that indeed chemotherapy will be helpful, if that's something in accord with your values. The other treatment decisions are based really as if this were an estrogen receptor positive tumor. That is, we will use endocrine therapy, and if there are features that make us more enthusiastic about chemotherapy, trust me, none of us is really enthusiastic about chemotherapy, but if there are other features of the tumor like a higher grade or other characteristics that make us think chemotherapy is more likely to help, the estrogen receptor low expression will be in accord with giving chemotherapy. So just to repeat that, because I know it's a little confusing, basically, when we look at reasons to give chemotherapy and reasons not to, low ER expression will be on the side where we're more strongly consider chemotherapy. Sorry, I used the word enthusiastic, but you know, it's all on a continuum, right? Now, if you are put on endocrine therapy and your tumor was low for estrogen receptors and you don't tolerate it, I have to say as an oncologist, I'm much more comfortable saying, you know, the benefit's probably a little bit lower in your case. And if you don't feel good on it, and we've tried changing your endocrine therapy, coming off of the endocrine therapy, I'm more comfortable with, and usually that means my patients are too. I'm not as committed to the endocrine therapy, though of course we always want to try it, because why not have another means of treating the cancer in your quiver? You know, why not have one more thing you can use? And it isn't that there's no benefit, it's just that it's not as robust. In advanced disease, as I mentioned, we tend to see fewer durable responses. The responses don't last as long and they're not as pronounced with anti-estrogen therapy in people with advanced disease where the tumor was low ER in terms of its expression. This was a lot to cover. I hope it's helpful. I know that it's hard sometimes to hear that your tumor might be more active and that chemotherapy might be more in line with what we offer, but I think having the most information you can, high quality information support, is going to help you during what is a difficult time, or for your family or loved ones, difficult time. I hope this has been helpful. Drop any comments or questions below. As always, you can go to yerbba.com for your personalized report. And if this has been helpful and you click like, that'll help other people like you find this video. And if you click subscribe, you'll see our new videos when they pop up, and we're always putting out new content.